So I know I'm like cranking videos out like crazy, but when I was driving, I thought of a really good topic for one. Um, sorry, I was asked the question on Tumblr, but I think yesterday about what treatment was like, especially for eating disorders, and I answered the question, and I thought it would also be helpful if I made a video of it for the people on YouTube to see, and you know it might help somebody because I definitely recommend treatment if you're suffering from an eating disorder, and by treatment I mean like going to the hospital or residential or whatever treatment. um I've been to two eating disorder centers, and I just wanted to share my experience about them and like how to make them best work for you. And I guess I'll start out with like the average, like what you do every day in a treatment center. Like I know it gets really boring at treatment, and that's what really sucks about it, but like it really helps. So basically what they do is they wake you up at like some god awfully early hour, and then you go to the bathroom, and then they have you they have you stripped down to your just your underwear, and they put you in a gown and they weigh you and do vitals. At some places, you actually are allowed to see your weight, but that's very unlikely. Like, the first one I went to, they wouldn't let me see my weight at all. And in the second place, they let me see my weight, but it was in kilograms. And I'm from the States, so I don't really know kilograms, but like, by about day two, you can pretty much figure out that, like, how to easily convert kilograms into pounds and stuff. So, yeah, but the main thing, after they take your weights and your vitals, you kind of, go back to your room, get ready for the day. You're allowed to wear like makeup and sometimes even do your hair. Like, again, the first place I went to, I was allowed to use a straightener under supervision, and I was allowed to use makeup. I mean, they took away like everything glass and everything, so that was like half of my makeup store, but yeah, and then after you get ready, you go to the lounge area, and you basically sit there and wait for the med line to slow down so you can get your morning meds. And even if you're not on like psychiatric medication, you probably will get meds for like just at least a vitamin or like a calcium supplement or a potassium supplement or some kind of supplement, but usually you'll be on a bunch of meds. And usually in that time, at least in my case, the psychiatrist would make her daily rounds, and she sees everybody. Like, even if you don't have a mental, like a pre-existing mental condition other than your eating disorder, she'll still check up on you and ask you how you're feeling and all that happy good stuff. And like, you usually see her for about like 5 to 10 minutes, and then she goes on to the next patient. Like, the one bad thing about eating disorder facilities is that there are so many people in there that you don't get a lot of one-on-one time with like a psychiatrist. But I mean, when you think about it, when you go to a psychiatrist, you usually don't get a lot of one-on-one treatment anyways, because they only have you for like 15-minute to 30-minute time blocks, and it's usually only 15 minutes. Then when usually that's done, which usually takes an hour and a half or something, you go to breakfast, and it's pretty traumatizing the first few meals, because they like usually sit separate from all the other girls and or boys, and you are watched very closely. There's always a monitor around your table, and they're telling you like, they're watching you eat and making sure you're not engaging in food rituals and stuff. Which, I mean, some of the food rituals are kind of ridiculous. Like, you can't peel the crust off your sandwich, or you have to, if they notice you're eating things in a certain order all the time, they'll ask you to change that up. And one thing about eating disorder facilities is that you definitely want to finish your food, because the outcome of not finishing your food is so much worse, because that usually means you're supplemented with Ensure, and it's just not fun. But usually meals are about an hour long, so you have about an hour to finish your food. Sometimes it's 30 minutes, but usually it's an hour. And after that, you go back to the lounge, you kind of goof around for a little bit, and then the groups start. And some of the groups you'll have while you're in a eating disorder facility is nutrition group. You usually have that about 3 times a week. And you also have various therapy groups, like group therapy, art therapy, and then just other like therapy groups that are based off of like getting rid of your disordered thoughts. And these groups are actually really helpful. Like, it may seem like a waste of time, but it's better than just sitting down and doing nothing. So, and also you can learn a lot from them. About halfway between your groups, you'll have lunchtime, which is basically the same thing as breakfast. Also, what I want to mention is like for the first few days, you don't really get to pick your food. Your food is picked for you. But if you get past the point of like probably after the first 3 days or something, you'll be able to pick your own food, which is really nice. But like you have to stay in certain guidelines, and like the nutritionist or nutritionists, however many there are, will definitely assist you with like figuring out like you need this many carbs, you need this many proteins, you need this many fats, and yeah. Also, you have to have like a certain number of condiments. Like you're allowed to have, well, at least in my experience, you're allowed to have 1 salt packet, 2 pepper packets, and like 1 thing of ketchup if you have like a burger or fries or something. Also, on some places, you're like in the first place I went to, I was a vegetarian at the time, and I was allowed to keep going with my vegetarianism. But the second place, they didn't allow vegetarianism unless it was like for a religious purpose. So I had to eat meat, which was really traumatizing, but it actually wasn't that bad. But if you're really stuck on your vegetarianism and you don't want to change, I would definitely recommend like searching to make sure vegetarian diets are included with your selectment of a treatment facility, because it can be pretty hard to like not have to eat meat after not eating meat for like 3 years. But sorry, my air conditioning just went on. After lunch, you go through other groups, and usually groups are about an hour long, and I mean, again, they're helpful because they take up time and they really do teach you stuff. Like, you want to pay attention in your groups because, I mean, that's a lot of the main reason you're there, of course, is to like, so they can force you to eat and shit, but another reason is that you have to go there for the groups and everything. After groups are done, you usually wait a little while, and then dinner time, which is again the same as lunch. Like, it sounds really boring, and I mean, I'm not gonna lie, treatment centers are really boring, but it's for the best, and like it'll really help you out, but only if you let it. Like, if you try to cheat the system, and there are ways of cheating the system, I'm not going to tell you because I don't want to help someone sabotage their recovery. But if you start cheating the system, it's really stupid because, I mean, they're probably going to catch you or kick you out, and you don't want to get kicked out because, I mean, that means you usually have to pay a lot more for your treatment, or you're just sabotaging yourself. You're not really helping anybody. So, you have to want to get better. Like, that's the thing about treatment centers. Like, at least for residential and IP, they kind of just, pump you full of food. But in residential, you have to at least try to get better, or else it's not going to work for you. You can't just sit there and be ambivalent about the whole thing and be like, well, whatever, I don't feel better, so what's the point of this? No, you actually have to work to get better, and that's really important. After dinner, you basically do nothing. Like, you really don't do much. Also, I forgot to add in snacks. There'll usually be at least one snack during the day. Sometimes you cannot have up to 3 snacks, but usually there's like 1 to 2 snacks throughout the day, and I don't really. They're usually placed like an hour after meals or something. Also, just if you're like underweight or severely malnourished or something, even if you have to put on like a little more weight and the food isn't helping, they will supplement you. And I mean, yeah, that's a really scary thought, but insurers really aren't that bad, and sometimes they give you boost, and I don't like, I don't really know anything else they would give you except like boost and insure, and also if you're you might be put on a feeding tube, which again is kind of a really scary thing to think of, but like it helps you with your recovery, and I mean, honestly, I think I prefer a feeding tube over, like 5 insures a day, which is basically the other option, and you're gonna have to do that anyways. Also, if you are breaking the rules, if you're exercising or they catch you exercising, or if you're standing too long or whatever, they will supplement you with insure. Like, it kind of sucks because one time I accidentally ran to get something real quick, and they gave me a little like shot of insure, and I took it pretty well, but yeah. Like, the thing about treatment is that you don't want to refuse your food. You want to follow the rules, or else it's just going to be harder for you. Like, especially if you're in a place where the treatment time isn't like set in stone, you will be there longer if you're exercising or you're refusing food. Because when I was in my first place, I refused food for about like 5 days. Like, I would eat breakfast and that's it. And the only reason I started eating again was because they threatened to tube me and put me on couch rest. And I mean, that's like the worst possible thing about like that could happen to you at an eating disorder facility, is if they put you on couch rest for misbehaving, because then you cannot get off the couch at all, and you are bored as fuck, and it's not fun. Um, that's basically after. I mean, after that, you basically go to bed. Like, after dinner, you basically just dick around until you go to bed. And also during the day, sorry, they'll periodically take your vitals, and also if you have a history of self-injury, they will check you for cuts and everything, like have you roll up your sleeves in your pant legs, and I mean, it can be pretty embarrassing, but like I've had them have to check my stomach before, so I'd have to roll up my shirt to expose my stomach because I have scars on my stomach. So I mean, it's not a bad thing because it's keeping you safe, but yeah. I mean, that's basically all I have to say about treatment centers. Like, they're not the funnest place to be, but they really help you. So I definitely recommend that anyone who's like doubting treatment but is recommended to go to one, actually you go to one, because it could actually save your life.